Welcome, everyone. And I have to say good morning, good afternoon, good middle of the night for people in Tokyo that are joining. And we are literally gathered from around the world. And that's quite unique. And thank you so much for that. So I'd like to welcome you on behalf of Columbia's Global Mental Health Programs and as a council co-chair with Chuck Goldstein and Stephanie, who you'll be hearing from later. Kathy just referenced, this week has been very nostalgic for me because I think of last year at this time. We were at this meeting on the brink of COVID. There were clouds that we could see, but wow, what a year it's been. Hard, long, difficult, but I'm very inspired at the things that we've accomplished. Many of us have reinvented ourselves through our careers, through learning how to Zoom. I thought it was funny the other day. I was thinking about, remember when that BBC reporter had his two kids come in behind him and that went viral? That's nothing anymore. We're so used to that that's hardly a thing. So we've reinvented ourselves. It shows like what the human spirit can do when there's an urgent need and when we cooperate, as we've had to do globally, not without some discordance, but cooperate and collaborate. We've really moved the treatment of the coronavirus so far, so fast, that it makes me realize we really can do so much together as a group. And I'm very inspired by all of you that have been willing to be ambassadors, that have supported us in this movement. And it really, this council all originated from all of you saying, what can I do to help? And as we collectively asked Columbia, what can we do to help? They gave us a great program that we can support. And so it's not just your donations, which we really, really appreciate, but it's your mentoring, your ideas, your collaboration and cooperation, and your support of scientists that are seeing the urgent need and fulfilling it. So I thank you so much and I welcome you. And I'm going to turn the time over to Dr. Jere Kane, who is a faculty member from Mailman School of Public Health at Columbia. And he is the co-chair for the grant review process.
Thanks very much, Jere, and warm welcome to all council members on behalf of the Columbia faculty. It's such a pleasure to be here and so nice, as Jere mentioned, that we're able to actually do this and make this event happen this year in spite of everything that's gone on. This luncheon is such a highlight for me usually and for a lot of us. And so I wanted to thank everyone involved who made this virtual version possible today. Thank you all for being here. And here's hoping for the opportunity to see you all again in person and really reconnect in person next year. So as Jere mentioned, and for those of you who don't know me, I am an assistant professor of epidemiology here at Columbia, and along with Dr. Tahilia Rebello, who you'll be hearing from a bit later on, am one of the co-chairs of the Council Grant Review Committee. Of course, as you know, the Council Grants Program is one of the primary initiatives of the Council with an aim of funding new investigators and new ideas in global mental health. And for me, it's really an honor to be part of such an innovative and impactful grants program that's been built through this council and through your generosity. There really is, from my perspective, nothing else like this in our field. In fact, the program itself is gaining global attention with other universities actually asking us about it. So we truly have built something really special here. Having received pilot funding myself early on in my own training, I can't tell you how important and in many ways career setting that experience was for me. So what you're contributing to is really making a difference, both in terms of the impact of the research projects directly on communities, but also in the careers of really the new generation of global mental health researchers. And so I'm really happy to announce this afternoon that thanks to your continued support, we have already launched our third iteration of this program. The 2021 call for proposals is officially out there, and we're looking forward to receiving and reviewing them later this spring. But first, of course, we'll get to what we're going to talk about today, which is to introduce you to our 2020 grant recipients whose projects are now underway. And thanks again to your generosity, we were able to fund 4 really exciting investigators in their projects this year. I'm delighted to tell you that once again, the recipients this year have blown us away with their proposals. So impressive, not only highly significant, highly innovative, but also ones that had to take into account, how do we feasibly do these projects during a global pandemic, right? So no small task. Truly an exciting 4 projects that were chosen. They represent a diversity of topics, of regions, of methodologies, and they're all really outstanding investigators. It seems like each year we do this, the bar is continuing to be raised with the level of investigators and projects that we're seeing. So I know you're all waiting to meet our new grant recipients and hear a bit about their work. So we'll get straight to that. And so the way we're going to do this is we're going to have our grant recipients introduced by either their senior mentor here at Columbia, in the case of our early career recipients, or by a colleague here at Columbia in the case of our more senior grant recipient. And so to introduce our first grant recipient and their project, so you can hear about it, it's my pleasure to turn it over to Dr. Milton Wainberg, Professor of Clinical Psychiatry and Director of Global Mental Health Research in the Department of Psychiatry at Columbia and New York State Psychiatric Institute. So Milton, if you are on the line, I will hand it over to you to introduce our first grant recipient.
Thank you so much, Jeremy. It's a pleasure to be with all of you again this year and to introduce phenomenally a wonderful Ali. Ali came from Duke, where she completed her PhD, and her focus of work is how you improve child and family mental health by working with parents. As you know, men need help and most of the time don't seek help. And she is targeting how do we reach men to help them get some mental health care and at the same time improve family and children's mental health. And she's doing that in Kenya, and she has developed an intervention. And this past year with COVID, she not only had a baby, but she just put an application to become an independent researcher. And she also got this grant with you guys. So she's very prolific and a wonderful human being. So with that said, I'm going to let Ali explain her little grant.
Thank you, Milton, for that introduction. And nice to Zoom meet everybody. So for me, ever since I can remember, I've wondered why boys get certain things and girls don't. Even in kindergarten, I remember feeling like things were just sort of not fair, and I cut my hair really short so I could try to get the same things that boys got. I kind of knew even then that I wanted to do things to help girls get access to things that boys seem to get. And never did I think this work would lead me to working with men and boys, which is what I'm doing now. So I started on this road a few years back while doing research on how families could help or hurt child mental health. It was during this time that I came face to face with the things that men couldn't access. I was helping to deliver and test a family therapy in Kenya to improve family problems and child mental health. And when we were delivering this therapy to the whole family in their homes, we were noticing dads weren't coming, but moms and kids kept saying dad, and dad's drinking were creating the biggest problems at home. As clinicians and researchers, we wondered how we could address these issues in the family if dads weren't there, or if we gave mom and kids skills, dad might not let them use those skills at home since he was often the primary decision maker. I admittedly felt pretty angry and frustrated at a lot of these men. But it didn't take long after hearing some of their stories to understand that these men were in a lot of pain too. A lack of economic opportunities left them unable to be the one thing they thought they should be for their family, a provider. This left them feeling depressed, without purpose, turning to alcohol often to try to feel better. This led to fights at home and no money left for things like basic needs, like school fees. It wasn't hard to see that these men were in pain and wanted help, but ideas and norms like real men don't need help left them feeling unable to access care without losing friends, family, and their identity. We see this pattern play out globally in sort of the worst way, with men experiencing rates of suicide 2 times higher than women, but seeking out treatment at rates 4 times lower than women. So that's what we want to try to figure out now with the funding you've generously provided. How do we engage men and fathers in mental health care? What motivates them? What stops them from getting help? What might push them to get help and stick with it? Basically, how can we help men access the things they feel like they aren't allowed to be a part of so they can start to create their own healthier stories? Along with my mentor, Dr. Wainberg, and collaborators in Kenya, we'll do this by asking fathers, families, and community leaders what they see as barriers and facilitators to delivering mental health care to men. And we'll work to come up with a roadmap of how to best deliver treatment to men in ways that make sense to them. This has potential to not just help men, but their families. Studies show us what we might intuitively know to be true. As father mental health gets better, their relationships and their child's mental health gets better too. Just think about our own lives in our small quarantine bubbles. If the people around you are doing a little bit better, you might notice yourself feeling a little happier too. So while women have the burden of raising children still in most places, the role of fathers is increasingly recognized as critical. But as you guessed, as the theme, fathers are missing from this work. Even now, if you Google search mom and dad at the pediatrician, about 1 in every 20 photos includes a father. So for better or worse, when we hear parent, many people think mother. But not engaging men and fathers in treatment and research is an enormous missed opportunity to help men, their children, and their families. And with this funding support, we hope to start to bridge this gap little by little. So thank you so much.
Thanks, Ellie. That was really great. So we'll keep it going now, and our next recipient will be introduced by someone who needs no introduction herself, of course, Dr. Kathy Pike, Professor of Psychology at Columbia, and among many other things, our esteemed chair of the Global Mental Health Program Steering Committee. So Kathy, I'll hand it over to you.
Thanks so much. It's really my thrill to serve as the Columbia faculty sponsor for Dr. Lola Kola, who is a senior research fellow at WHO Collaborating Center, University of Ibadan, Nigeria. And Lola is just a powerhouse and a rising star. And in fact, was awarded the NIMH grant for Emerging Global Leader in 2019 to work on perinatal depression in adolescent girls. It's a highly prestigious, highly competitive grant that she received. And so why the council grant? Because Lola began her study focused on young women, adolescent girls, around pregnancy and mental health, and found that the study design was not working. And she had some ideas for how to pivot, but didn't have funding and needed to test those ideas and needed funding support to find out would they help her in her larger study. So she's here to share with us a bit of her story and share with us how important it is to keep asking the right questions and how important it is to continue to learn as we do our work as researchers. So Lola, over to you.
Thank you very much. I'm happy to be here. I'm happy to see everybody. Firstly, I would like to thank the council members for funding this project. Like Kathy said, this is a project that, this grant might be small, but it actually does mean a lot to me. There are times when you do some work, and I'm a researcher, I've been engaged in quite a number of research, but you have satisfaction working in some areas, and this is one of it. This is a project that I'm actually very happy to work on. The title is Responding to Challenges of Perinatal Adolescent Depression with a Digital Video Intervention. Just giving a little background, adolescent perinatal depression, we know it's a public health issue, but more so in sub-Saharan Africa, because in sub-Saharan Africa, we have the highest in the world. And in sub-Saharan Africa, Nigeria has the highest because out of girls aged between 15 and 19, we have about 23% of them already having babies in that age group. So, and then perinatal depression, like we know, is more prevalent in younger people, and they have very severe consequences. They have worse consequences because their children have higher levels of psychopathology. In Nigeria, because of limited resources, the care for perinatal depression is by non-specialist healthcare providers in primary care. It's not like you have it in some of the countries, and primary care are manned by doctors. These are by non-specialist healthcare providers. In a recent study, we found that this, I'm giving a background of what led to this. So in 2016, we did a clinical trial. We found that these young girls, despite effective treatment in primary care, their children did poorly. These girls would not go to the clinics. They had higher default rates, and then they actually lacked parenting skills. So as part of the process evaluation of the study, we wanted to find out what the problems were, because the nurses found them annoying and difficult to treat, to actually work with. So we brought them, okay, so initial plan was to have a face-to-face interview with them. So that's the story. So after 8 difficult interviews, I had to stop, because I saw that these girls were not talking. I mean, many people can relate with these teenagers. Sometimes they don't talk. Many of them, they like talking on a one-to-one basis. But so after a while, and then I just decided that, okay, why don't I bring them together and see what's gonna happen? So for the process evaluation of that particular study, we now brought them together to find out what the issues were, why they were doing the things why they weren't cooperating with the nurses. And despite the fact that we were dealing with people that were strangers to another, they just couldn't stop talking in a group. They didn't know each other. It was like a dam broke. And then they just kept talking and giving us even more information that we needed. I mean, there were many times you had to just calm them down, So moving forward, I thought about this, that working with these girls in groups, we actually could do a lot more for them if we bring them together and tap on the group, on the interactions they have and the chemistry they have with each other, that we might be able to really help them. So that's how this project came about. This is despite the fact that I have an NIH project that it's a one-to-one. I mean, this is very different, because now we'll be using this group, we'll be taking advantage of their connection in groups. We'll be using short videos, and then we'll be using peer counselors. We'll be tapping on the use of peers, which is on the used community resources, which has the ability to be sustainable. So in this project, we are going to be, it's going to be merged with face-to-face. So we have peer counselors. They're going to provide other members with practical, social, and emotional support within the group and outside the group. So what the impact of this project is such that we are creating a community for girls who otherwise will have been alone. So they're going to, we know that we are planning, our strategies is that these girls, even after the project, they will still have friends among themselves. I've been working in primary care for over 2 decades now, around 2 decades now. And I see how difficult it is for these girls to cope. Knowing that there is a way to impact their life, even if it's just taking just a little bit out of the whole, I know the problem is huge and the grant money might be small, but I'm excited with the thoughts that we actually will be able to impact the lives of some of them. So I would like to thank the members of the council again for this project. And I look forward to working with Professor Pike on this. She's very kind. She's given me a very kind introduction. She says very nice things to me. And by the way, she was the one that sent me the announcement for my NIH grant that I got. I mean, I told her so many times, but I've told so many people, and it's just something that gladdens my heart, because she's actually helped a lot in building my capacity. She might not know how much she has done, but take the invitations for the Global Mental Health Scholars when we were going together, when we were able to go around. I was lucky. I had 2 terms. So, I mean, that really impacted my life a lot. Thank you very much, everybody.
Thanks so much, Lola. That was really outstanding. Really great work that you're doing. So moving on, it's now my pleasure to introduce Dr. Geoffrey Reed, who will be introducing our next grant recipient. Dr. Reed, of course, is a member of our Global Mental Health Programs Faculty Steering Committee here at Columbia and professor of medical psychology, as well as co-director at the Columbia WHO Collaborating Center for Capacity Building and Training in Global Mental Health. So Jeff, please take it away.
Sure, thank you. It's really my great honor to introduce Dr. Maria Elena Medina-Mora today. Dr. Medina-Mora has had an illustrious career as a researcher and a leader in our field, and has been especially committed to reaching underserved communities with a particular focus on women and substance abuse. She herself was the first and so far only woman to be named as the Director General of the National Institute of Psychiatry in Mexico, where she served for 2 terms. And she was the founding director of the Center for Global Mental Health, the Global Mental Health Research Center at the Institute. She's currently the director of the School of Psychology at the National Autonomous University of Mexico, which is arguably the most important university in Latin America. She has been an important collaborator from the beginning of our center. I want to say a word about the fact that she's getting this award because she's obviously somebody who's quite senior. This grant program that's being funded by the council has 2 main purposes. Most of the awards go to support young investigators who are making a range of contributions around the world to global mental health research. And we've heard 2 outstanding examples today. Those awards are really designed to help support their development as independent researchers. However, a small number of awards can also go to more senior investigators who are pursuing innovative new directions in global mental health research and require a kind of proof of concept in order to apply for larger funding opportunities. So the project that Maria Elena will talk about is in this latter category, and I think it's very exciting, and we look forward to seeing how things go. Dr. Medina-Mora.
Thank you very much, Jeff. And thank you very much, Kathy, for this great opportunity. I think that this research, as Jeff has already said, will make a difference in the way we can do research for Central American migrants in Mexico. And I will tell you why. The research on international migration has been a focus on my research since 1983. And there is a particular story that had a big impact on the way I approach my research. A man from Central America, traveling with his wife and children, had been forced to leave his home due to conflict and violence in his community. He was confronted with an unknown, unsafe territory, Mexico, on his way toward the United States. During his journey, they were held up by assailants, and his wife was taken aside by a man while her husband, took care of the children. She came back, tried to fix herself, and stated, "Nothing happened, let's keep going." They both knew what just had happened, but continued. I then realized that they were doing their best to survive, and perhaps I could do my part. Stories like this one led me to try to address the gap in the knowledge we have regarding how many migrants in similar conditions of vulnerability and disadvantage were crossing through Mexico on their way to the United States. I wanted to learn more about what were their treatment needs and study their incredible and underlying resiliency in order to inform policy. Because the vast majority of the massive wave of migration from Central America entered Mexico unofficially, the size of the current population of migrants is unknown. That is why the first aim of our study is to evaluate an innovative method to estimate the size of this population. We will use a capture-recapture methodology to estimate the population in migrant shelters. We will also develop a methodology for assessing the migrant population not living in shelters through observation of other sites where migrants gather and through conducting key informant interviews. We are hoping that through this method, we will be able to estimate how many migrants there are in Mexico and also obtain a more representative sample in order to study their circumstances and their needs. An increasing number of these migrants have been stranded in Mexico, waiting indefinitely at the northern Mexican border points to enter the US. The situation at the border will certainly change with the new administration, but the situation is difficult and it will take time to resolve. In addition to the experiences of displacement, violence, and extreme poverty in their countries of origin, their traumatic journey has compromised the well-being of many and negatively affected their mental health. The second then aim of our study is to gain information about reasons for migration, route use of migrant shelters and other available services, exposure to violence and other types of victimization, and level of food security and hunger, but before and during migration, their coping mechanisms, and to assess their mental health and treatment needs. This information is urgently needed for the Mexican government to make appropriate plans to address the needs of the population and prevent additional suffering and disease burden in Mexico. I am very grateful for the support that will allow me to do my part, and I think that only grants like this one that are allowing us to test these innovative methods can help us make a difference and then go for bigger grants. So I am very thankful to Kathy for all what she has given us during all these years in the global initiative of WHO, and also to Geoffrey Reed, who I have worked with him for the last 12 years, and his presence in our institute and our country has given us a lot. So thank you very much, and I'm hoping that we are really successful in this big initiative.
Thanks so much, Maria Elena, for such fantastic work in this project and of course throughout your career. Really, really fantastic. Thank you. And now for our fourth recipient this year, we'll have an introduction by Dr. Sandra Matz, who is an associate professor of management in the business school here at Columbia and affiliated with the Columbia Data Science Institute. And we're so excited to have her involved in the global mental health programs this year. So Sandra, I will hand it over to you for our fourth and final introduction.
Thank you so much. It's really amazing to see so many of you. I know that obviously it would have been nice to do this in person, but it's great to at least get to meet you virtually in this case. And I'm also really excited to introduce Dr. Sandrine Muller, who I've actually known for a couple of years now. We overlapped at our time at Cambridge University, where Sandrine got her PhD, then moved through various places, Austin and Stanford together. And we've continued working over the years, really on kind of mental health, well-being across the board. And I think what makes her research really stand out and really exciting in my opinion is essentially the idea that we oftentimes think of technology as something that is impacting our well-being, right? So there's a lot of talk of how social media has changed and impacted mental health. But what Sandrine is doing is really trying to use technology as a tool to better understand mental health. So most of us now have smartphones with us pretty much 24/7, and which really gives us this opportunity to understand well-being as it plays out in everyday life. So instead of having these snapshots here and there when we talk to clinicians, talk to our doctors, we can really see how mental health plays out over the course of people's everyday lives. And obviously COVID is a pretty unique situation in this case. So this is one of the questions that we were interested in and that Sandrine has looked at with the help of this grant and your generosity, is how did mental health really play out in the context of COVID-19 over time and across different countries. So Sandrine, the stage is yours, and thank you all for being here today.
Thank you so much, Sandra. Yeah, I want to echo Sandra's sentiment. It's really a pleasure to be here today. Of course, it would be great to be together in person, but I think this format also allows us to bring this global community together, and everyone can just click on a link and join, whether they're in Japan or New York. So that's really exciting. The big question that I'm focused on, as Sandra already alluded to, is how we can use technology to understand the impact of COVID-19 and social distancing on mental health. Since the beginning of my studies, as Sandra already described as well, I've been fascinated with the opportunities that technology affords us for psychological research. Psychological research in the earlier days was conducted very differently. Observational studies were very time consuming and didn't scale very well. There's a famous study that was conducted in 1949 by 8 researchers who followed around a 7-year-old boy for 24 hours, and they wrote this 435-page report that they titled One Boy's Day. This, of course, as I said, was very time consuming, and this sort of approach doesn't scale well. Today, we find ourselves in this situation where almost everyone has this supercomputer in their pocket that's capable of passively tracking information, such as where you are, what you're doing, and with whom you are at any moment in time. So this, of course, allows us to radically transform the kind of research we can do in psychology. There has also been a lot of news coverage on what a disaster the COVID-19 pandemic has been for mental health. Organizations all across the board, such as the Red Cross and the UN and many major news outlets, are talking about a mental health crisis that is affecting the population and is going to affect us for years to come. These headlines are, of course, very alarming, but so far there's actually very little data that clearly supports these statements. And so Sandra and I were able to get access to a data set from a mobile mental health app, which people use to track their mood and depression on a daily basis all across the world. We focused our initial analyses on 3 countries that have the largest app user bases, which are the United States, Germany, and the United Kingdom. And for the COVID-19 period, this past year, essentially, that we've now been looking at, the data set contains about 1 million people who have provided about 35 million observations. So this is really very large data set that technology allows us to look at. And the first question that we asked ourselves and that we were looking at is how the pandemic has impacted mental health trajectories over the pandemic period. And what we can see in the data is that people are actually very resilient. The US saw a temporary impact around mid-March when COVID-19 was declared a pandemic by the World Health Organization, but actually recovered very quickly. And in Germany and the United Kingdom, there was no notable impact of the pandemic onset. This actually also speaks to differences between the countries and how the pandemic was handled in different countries, of course. Users in Germany, where the response came very early and was coordinated and effective, are faring much better, it seems, than those users who find themselves in the United States, where the response was more delayed and the cases grew to much higher numbers. What the data also shows, though, is that the start of the fall that brought, again, rising case numbers and new lockdown measures actually also brought drops in mood and increases in depression in all 3 countries that we're looking at, highlighting how this pandemic that is ongoing is actually challenging as well. So the second question that we asked ourselves is how mental health is related to social distancing. And the data here shows something very interesting, that not all COVID-19 experiences are created equal. Some people are definitely suffering from these strict social distancing measures that have been placed on many people and the lack of social connectedness that results from it. But other people are actually doing much better in lockdown than outside of it and seem to be benefiting from maybe a more simple life with fewer social pressures, maybe less work burdens and more time to oneself. So where do we go from here? The analyses that we were able to perform highlight that people are very resilient overall, but also that there are very vulnerable populations. And we need to clearly identify these groups and their very specific needs so that we can allocate scarce mental health resources accordingly, develop custom approaches that specifically target the needs and situations of different groups. So if we think, of course, of, for example, frontline healthcare workers, parents or children, these will have very specific concerns, such as the social isolation that they find themselves in during either quarantine or lockdown, maybe grief after the loss of a loved one, potential financial difficulties, loss of income, and the strains of homeschooling and caring for dependents. So all these things are, of course, very difficult, and people are clearly struggling, especially as this pandemic has been enduring. And we hope that we can use the power of technology here as well to make a difference, to use, for example, approaches such as telehealth, virtual mental health services, and also online communities to connect people with each other and support each other and get treatment to those who need it the most and also in the way that is most helpful to them. At the same time, and my final thought for this is that we should not forget about the positive sides, the insights that we can gain from people who are actually thriving in lockdown and enjoying the slower, more mindful existence. And maybe we should also think about how we can find ways to preserve those aspects beyond the pandemic. And finally, I'm very grateful for the generous support of the Council that allows us to do this work. Thank you very much.
Thanks so much, Sandrine. That was really amazing. And really to all 4 of you, again, I wish we were in person. We could give you an actual round of applause, really standing ovation, but maybe a virtual one from everybody. To all of our recipients, really fantastic work. Thanks for everything that you're doing for communities and for our field. So we're going to move now into the keynote address phase of the lunch. And so in order to do that, I will turn things over to our council co-chair, Stephanie Guyett.
Hi, everybody. Thank you so much for being here. Thank you to our award recipients for those very interesting and cogent explanations. I can't help thinking that the things that they are concerned about are so directly connected to the subject of the book that our keynote speaker is going to be speaking about, which is connection from oneself all the way through community and how that affects your health and obviously your mental health. We're so delighted to have Dr. Kelli Harding, who is the author of our book today, The Rabbit Effect, and is an assistant clinical professor of psychology at, psychiatry at Columbia University Irving Medical Center. She's a diplomate of the American Board of Psychiatry and Neurology and boarded in specialty of psychosomatic medicine. She studied political science at the University of California, Berkeley, did a year of AmeriCorps service in Washington, D.C., and then conducted her medical training at the University of Rochester and Columbia. In addition to completing a 2-year National Institute of Mental Health research program at Columbia, Dr. Harding has spent much of her career working in the ER at New York Presbyterian Hospital. Her home is in New York, and she has 3 boys and a guinea pig, not a rabbit, and named Calypso. And she met her husband on a flight to London when she asked for a last-minute switch in seats and has been a believer in everyday magic ever since. We're looking forward to this conversation with Dr. Harding, and she's going to discuss her experiences and expertise on the impact of kindness on physical and emotional well-being and the importance of translating that into practice. Dr. Harding will be joined after her initial comments by Dr. Pike, faculty chair of our global mental health programs at Columbia, for a conversation. And please feel free to enter any questions you have in the chat. And we will moderate them and bring them up when the conversation time comes. So without further ado, I will turn it over to Dr. Harding.
Well, I wanted to say thank you so much, Stephanie, and to Kathy and to this group. It is absolutely in line with what I write about in The Rabbit Effect, to hear about all these incredible projects that have happened, and particularly Ali, Lola, Maria Elena, and Sandrine. It's actually quite striking to me that the work that you're doing, how meaningful it is. And I can just hear the sense of purpose also with what you're talking about. So I'm delighted to be here and also to see so many wonderful familiar faces and new friends as well. Hi, Kathy.
Hi, welcome. We're so glad you're here, Kelli. Thank you so much. And I think, as you know, our council members have received a copy of your book, either the physical book or the virtual version of it, and are at various stages of reading through it. So maybe we can just start at the beginning. We have about 15 minutes for a conversation to talk about why you named it The Rabbit Effect. I guess I'll give you a couple of questions and then you go where you want to go with it. But why did you name it The Rabbit Effect? And for people who haven't gotten to that explanation yet, maybe frame it for us. And then if you can speak to what's at the heart of this council, which is how we bring together a community of individuals who are helping us turn science into action in a meaningful way and improving quality of life related to mental health. So pick up on that wherever you might.
So, so you're doing that all right now, which is really exciting. And I have to actually just back up for a second, Kathy. So, you know, this book actually was my public health thesis at Mailman, and that's how it started. That was the origins. And I mean, it sort of starts way back before then, sort of at the beginning of my medical training, when I started to ask this question about what are we missing when it comes to our health? Because I think, like many people around the world, I had, particularly in the US, I had very narrowly defined health, thinking about in terms of what's happening inside the body. And then, of course, as I moved along in my training, I just kept discovering, you know, these sort of medical mysteries, like people with very serious diagnoses who managed to continue to do quite well despite their prognosis, or continue to feel and function well despite their diagnosis. And then the flip side of that, people who don't feel well and don't function well and are yet on labs and physical exam, they look perfectly good. So that was sort of the mystery that literally led me down this rabbit hole and led me to standing here in front of you today. So so that mystery led me through this sort of circuitous training, which passed me through Columbia, that played a critical role. And that included, initially starting in internal medicine and then psychiatry, because I thought it had something to do with the mind-body connection. And then eventually I heard about these rabbits. So I did a research fellowship at Columbia with Brian Fallon, looking at medically unexplained symptoms. And it was exactly this question, like, what are we missing? And during that fellowship, I heard this story about rabbits from my mentor, Dr. Arthur Barsky, who's at another institution. And Arthur described, because he knew that I was interested in this sort of mystery connection and how our social world gets under our skin. So he described this story about the rabbits. And the story basically goes like this. Back in the late 1970s, there was, they were still trying to make the connection between heart health and diet. And so a basic scientist was doing this study with these white rabbits from New Zealand, all virtually genetically identical, gave them all a high-fat diet, and he expected the same health outcome. And instead, what ended up happening is one group in the study had far better health outcomes than the other rabbits. And being a good researcher, he thought there was something wrong with the study design, but in fact, everything checked out. Finally, he realized it had all the that had done better were under the care of one researcher. And it turned out she wasn't just feeding the rabbits, she was also picking the rabbits up. She was petting them. She was basically giving them love and kindness. And he got so intrigued with this idea that somehow the social world could be changing biology that he repeated this experiment with really tightly controlled conditions. And it ended up getting published in the journal Science. And then, of course, we now have decades and decades of research that support this about how our social world gets under our skin. And in fact, we have Dr. Ezra Sussman on the call, who I have to say, I was so intrigued by his studies. That also was a piece of this that literally got me across the street at Columbia into the School of Public Health, where I learned all about the social dimensions of health and this larger story about health, that we have to start thinking about health far beyond just our bodies alone, but what's happening in our communities and how we're connecting with one another, and particularly positive connection, which is something that I've heard a lot in the theme of the different grants that have been offered today.
Great. Thanks so much. So as you think about this council coming together, as we alluded, or as mentioned early on, we met a year ago, exactly 1 year ago, February 24th, 2020. And a lot has happened in this last year. And so, of course, one of the questions always is around, given the pandemic, how do we think about the rabbit effect? How do we think about kindness in the context of less fortunate circumstances? There's the tendency to think when circumstances are right, we will have capacity. Mm-hmm. So what do you do when circumstances aren't quote unquote right? How does this story still play out?
Yeah, so Kathy, I love that question, because I think that's the thing. The circumstances are never right. And we have to do what we can with where we are right now. And, right now is a difficult place for a lot of people right now. But that being said, one of the things that was just sort of echoed again and again throughout the data was this idea that we have so much more power to make a difference than we realize. And there are all these sort of hidden factors of health, all the different areas of the social dimensions of our connections, starting, in our our homes, our workplaces, our education environments, our neighborhoods, our broader societies, and how we treat each other. And what's neat is each of us every day is interacting on so many different levels. And in our tiny moments of our day, we actually have the opportunity to make a big impact on the people around us. There's this lovely ripple effect. We know from all the data that the social world is impacting our individual health, but what's really amazing is we're also simultaneously impacting our social world. And this is where I found it so empowering that this is actually what really drove me to write the book, because I realized, we can't just be talking about this in the context of health. Like, we have to be talking about this in terms of our community and how we think about mental health every single day for all of us. So, so I think that's the thing, little things, even things like connecting with someone by, waving at, a neighbor that you pass by across the street, or reaching out to somebody that you haven't talked to in a while, investing in programs like this, all tremendous. These make a huge difference. And what's really cool about your program in particular is it makes a difference around the world.
Thank you. Thank you. I wonder, as we think about, as I read your book, one of the distinguishing features, Kelli, is you have really dug deep in the research and have tied your recommendations to very real science. And there's a lot of pop psychology and lots of recommendations that are people's good ideas, maybe, but they're not really tied to science. But that's not how you went about doing this. And for me, that's really the power, or a piece, one of the ways in which your book is so powerful. And I wonder, because it's so much aligned with what our council grants are about. It's about taking science and implementing them and trying to make them happen. Can you talk about how that's, what are the challenges in that? How do you take science and translate it into The Rabbit Effect, a book that's accessible to all of us? And any gaps that where you wish there were more science, where the researchers could fill in some gaps?
Sure. So this is, I think there's all these studies around implementation science. So a lot of times the research is there, but it's not actually, we talk about in the hospital, it's not necessarily at the bedside, or, we talk about, it's not really, it hasn't informed the day-to-day care. And of course, the classic example we use in public health is around, scurvy and vitamin C, that it took, hundreds of years before, even though it was well known, and there were actually some studies to support it, some initial studies to support it, that sort of an easy fix wasn't implemented. And that's where, once I got into Mailman and I started to see all the data, and it literally felt like a tidal wave of data that's there, and there's still so much more need. And I think we've talked about that today, some of the niches where that's particularly needed as our world unfolds in front of us. But that said, it also felt like this is something, there is enough evidence, we don't have to wait, we can start taking actions now. And I think one thing, because I wrote, the book came out right before the pandemic, and the pandemic has really, in many ways, reinforced the lessons, and in many ways made it easier for people to understand how interconnected we are. But, that's where things that feel small, whether it's, investing in one pilot program or investing in one grant, or, reaching out to one person, it may feel small, but we know that the evidence shows that that's really powerful. And I think the more that we can support that evidence, the development of it, and then the implementation of it, that's where it's exciting. And this is where I thought about sort of writing a policy book. We need to make policy changes, across the world, but it actually feels like we also need to get buy-in from just everyday people, understanding that positive connection in our community is a tremendous investment in our health. And in fact, the evidence really shows if you can invest in one thing, it's really those positive connections. Mm-hmm. I was actually thinking about Sandrine's work in terms of sort of connection. We've seen that connection is important, but it can also be detrimental. So we have to think about how can we make those positive connections happen. And that's where evidence is critical.
Mm-hmm. Terrific. So one of the questions that often comes up as we reflect on this past year is how do we come together in a polarized, in the world that can feel very polarized, and how do we, and also how do we think about this across cultures, right? So when there are groups that are quite different,
Yeah.
or have very different views of things, where does kindness come into play, and how do you, what's your thought about bringing kindness to negotiation, kindness to conflict resolution?
Sure. So I want to just start by sort of how do we define kindness? So I realized in the process of writing the book that, and maybe some of you on this call have experienced this, sometimes when you talk with people about the social determinants, even within healthcare and public health, there's not always that sort of burst of enthusiasm that this is something that impacts all of us, like the weather. It's ongoing every day, all the time. And I realized the further I got and the more I talked with different people that what we were in essence talking about was kindness. And so that's the way that I framed the book, sort of thinking about it. And the definition of kindness, I just want to read you the consensus on it, is an act that enhances the welfare of others as an end in itself. And what I like about this description is that may look different in different places around the world, and you have to tailor what that looks like to different environments. And that's exactly what I hear is happening with this work. I think when you peel back the layers, there's sort of this general sense that that there's something underneath, this sort of basic thing, and every single person who's participating in this call today has experienced kindness. We know that feeling, what it's like, and we have also given kindness, and that may look different depending on different contexts. So that's one piece of it. The other thing is, I in writing the book, I really wanted to highlight global mental health as well, because we know that disability is the leading cause, depression is the leading cause of disability around the world. And yet it's, very underinvested. Despite that, it's like, over $1 trillion a year, let alone the unquantifiable costs on families and friends. And, that's where it felt like, if anything, we need to be highlighting that this is something that's really critical to us, and it's part of the fabric of how our world could work. And I think the thing is, when you look at what could be done, there's so much potential. And, we are so creative, and we can come up with these ways to make the world a far better place, and to work together. And we've seen that in some respects with the pandemic. And I think if any lesson we can take away from it is that as we continue to work together, continue to invest in science, continue to pay attention to mental health, we can make, our society much stronger, and our global society.
Thanks, Kelli. We could talk forever about this. I just really want to salute you for the work that you've done, for taking science and really empowering people, and providing a real understanding of how we can each make a difference. And thank you for linking that to our council, because we very much feel like that's true for all of our council members here, who are very much making a very real difference in their acts of generosity and kindness. And what we'd like to do is, in the interest of staying on time, and the official wrap up at the top of the hour, I want to say to everyone who's on that we're going to stay on the call for an extra 15 minutes with the grant recipients and with Kelli for any questions that people have. But I'd like to, for those who have to end at top of the hour, let's wrap at the top of the hour. So I'm going to thank you, Kelli, and turn the microphone, let's say, the virtual microphone, over to Tahilia Rebello, who's going to give us some highlights from our first class of fellows, and just share with people the trajectory that our first class of researchers are on. Thanks, Tahilia.
Thanks, Kathy. Hello, everyone. I'm Tahilia Rebello, and it's my pleasure to very briefly report to you the progress and really impressive achievements made by the grantees of this Council Award in our 2019-2020 inaugural year. So the first project you as a council funded was led by Dr. Sion Firu and Dr. Claire Green. Their work was done in Ethiopia and focused on better understanding the mental health needs and the types of mental health resources that were available to a particularly vulnerable group of people. And that group is refugees and other displaced people living within Ethiopia, of which there are about 3 million. So Sienna and Claire's project is really important because we know that in terms of mental health, these vulnerable groups have experienced stress and trauma that may really impact their mental health. And they may be in need of mental health services. So it's important that those services exist for them if they need it. Over the last year, Sienna and Claire, working through the pandemic, were able to have many essential interviews and build partnerships with many of the people who either provide services for refugees and displaced people, such as clinicians, or that help organize and fund care, like government officials, to get at this question of what resources really exist for these groups. So through their work, they were able to see what services were available and, more importantly, what services were not available. So they could then work with their partners that they've developed and the partnerships that they developed over the year to really get these services in place. So really, really great work. The second project was done by Dr. Franco Mascayano in Chile. And his project really focused on getting people with serious mental illness, specifically those experiencing psychosis, the screening and care that they need. So Franco's project is extremely important because we know that the sooner we can detect mental illness, and such as the first time someone experiences psychosis, and the sooner we can get them the care they need, the better they do. Through their work, Franco and his team were able to make really fantastic progress in figuring out the factors that either make it hard or easier to be able to identify people with serious mental illness. And their team can now use this information to design better programs, better policies to get people who may need these services the care that they need so they can live better, longer lives despite living with serious mental illness. Again, a really important project that the council was able to fund. The third project you funded in 2019 was led by doctors Laura Kurdisco-Sai and Katie Carlson. Their project was done in the Philippines with survivors of human trafficking, a group that, as you can imagine, has experienced a lot of trauma that can have tremendous impact on their mental health. So many of these individuals experience severe mental distress that can lead to attempts of taking their own life. So as part of their project in the last year, Laura and Katie were able to create a culturally appropriate program that made sense in the Philippines to help screen survivors of human trafficking for suicide and self-harming behaviors. During the year, they were able to do training for all of the staff that they were working with in the Philippines on how to do this suicide prevention work, and they already started getting care to survivors. And impressively, they were able to find that just in this short amount of time, they saw a decline in suicide risk in 95% of survivors. Again, really tremendous work here. Finally, the fourth project that you funded was awarded to Dr. Manuela Oruela Grimm and Dr. Roberto Luis Fernandez, who worked in the United States with Latin American migrant youth who arrived in the country not accompanied by a parent or guardian. So these children, as you can imagine, experience a lot of really distressing experiences in their journeys that bring them to this country. But we know that many of them find ways to cope. And if they are connected with relevant resources in the community, can potentially heal and do pretty well. So Manuela and Roberto over the year directly interviewed migrant youth that they were connected through their partnerships with local NGOs and other organizations to be able to better understand, how are these children coping and what resources in the community are they using to do so. And they were actually also able to capture some of the impact of the pandemic on these youth. They used the knowledge that they gained through their project to develop a kind of structured way to measure coping and use of community resources that can now be applied to other migrant youths throughout the country and potentially in other countries as well. They were also really importantly able to develop the partnerships in the community and with other schools in Colombia to now apply for additional funding to continue this work, to get better services to care and provide care for migrant youth in the United States. So I'm going to stop there. I hope it's clear from just this brief report that your contributions were really able to fund a fantastic body of work that is so relevant to some of the key issues in mental health. Thank you all very much for your support.
Well, thank you everybody for attending. And I'd like first to thank our colleague and author, Dr. Kelli Harding. Dr. Harding's capacity to take basic social science and translate it into meaningful application in the rabbit effect is a model that we aim for in global mental health. We take what we know, we learn from it, and put it into practice. We also want to congratulate our second class of council grant recipients, Dr. Ali Giusto, Dr. Lola Kola, Dr. Medina-Mora, and Dr. Sandrine Muller. We have enjoyed this chance to learn about your passion in making a difference around the world with your innovative research. Thanks to the faculty who lead this program, research at Columbia, and provide the vision and inspiration for the new ideas and the new investigators. Most importantly, I'd like especially to thank the council members who have joined us today and those who couldn't join us today but continue to serve as allies and supporters in making science matter in the real world. The support of this council is what allows the Columbia Global Mental Health Programs to have this unique grants program, which fills at least two critical needs. We are able to launch the next generation of thought leaders and researchers, and we're able to support the development of scientific knowledge that can be put into practice in the real world. Our grant recipients will stay on the call together, as Kathy mentioned, until 1:15 if you have any additional questions about their research. And with that, we will conclude our 2021 annual council meeting. Thank you all for joining us, and hopefully next year in New York.